Hey there, my name's Chris McDonald. I'm a licensed therapist, yoga teacher, and I help other therapists learn how to bring yoga practices into their sessions ethically and safely. And I wanted to talk today something that came up. I had a networking online with someone who is also a yoga teacher, but also a mental health therapist. And we had a really interesting discussion. And one thing I know that she mentioned was how sometimes it does not translate from yoga trainings to mental health therapy. How do we bridge that gap? Because I know when I finished my 200 hour in 2019, I was like, wait a second. Okay, so we have, we learn about the limbs of yoga, asana, breath work, meditation, pratyahara, all of that, the yamas, niyamas, great. But there's not really anything bridging that gap, which is one reason I created a course called Yoga Basics. I was like, so many listeners to my podcast and other therapists I've worked with in consultation have just looked at me with that puzzled look like, wait, so we have these, which are great and they sound wonderful to bring into session, but there's so many missing pieces from traditional yoga trainings. And that's what I wanted to talk about today. Because I have found that many times it's people who are not mental health therapists who teach yoga, which is great. That's their specialty. They're experts in the yoga world, but they're not often experts in the mental health world. Maybe they have some knowledge. Sometimes they have trainings or they know people right in the field and they get a lot of consultation, but there is that missing piece. And the person I talked to yesterday did talk about how, she's done taught classes in the community, and often yoga trainings are geared towards how do I set up and teach a class? How do I be proficient in this to be able to sequence? What are the cues? What would be a good flow depending on the type of yoga practice? And building confidence with that. What could that look like, feel like? That doesn't quite translate to the mental health therapy room if we're one on one, or even if you do yoga with couples. So, hmm, that is a big question mark, isn't it? Often, because it is a big difference to teach yoga in a class, totally different energy, different vibe, different skill set versus as a mental health therapist. How do I bring this in safely, ethically, and effectively? It's such a difference. And it's more intimate, right? It can feel awkward, uncomfortable. I know I've talked to some yoga teachers who are totally skilled at doing the group setting, but one on one, they're like, ugh, I'm just not as comfortable to do my one on one yoga practices with people. So I think it does take a different mindset with it, a different mind shift, maybe we should say, a different energy. We can individualize, which there are some real benefits, right? If we work on one with clients versus a classroom, and then we can really figure out what that person is needing in the moment. So there, that is beautiful. But we also don't have the group. There is some downsides too if we're one on one that we don't have the group setting, because I think moving through flows in yoga in a group really builds that sense of community and connectedness that we don't get always one on one. I mean, we can because if there's two people connected, but it's not quite the same, if that makes sense. And what I found is in the trainings that I did too, started back in 2015, I had a chair yoga training for therapists, but there was that gap again. It's like, here's some chair yoga poses. Go. Here's a script. Go. I was like, wait, what? So it kind of leaves you with like, where am I going? How do I do this? Big question marks, right? And what I found over the years is it doesn't translate. Okay, we have a mental health therapy session. Folks come to us most likely because they want to talk about an issue and maybe build coping skills. They want to process through childhood trauma, anxiety, depression, whatever it might be. But they're not coming to us specifically for yoga. If you go to a yoga class, you know the expectation. I'm going to start with the class and the teacher leading me. They don't come to therapy typically. Now, I would love to see a world where people do seek out mental health therapy for yoga, but we're not quite there yet. Um, certain certain parts of our field is moving in that direction, but Yeah, we're not there. They are coming there for mental health therapy. So again, this is more an alternative and complementary practice to what we already do in mental health therapy. So just remember that too. It's not the main focus. Yoga class is the main focus, just yoga, right? Mental health therapy. Typically people come to us for that. So I think that's kind of the gap too, is like, ooh, wait, people were coming to me for this, but I'm going to introduce something else. So I'm trying to bridge that gap. And I think where that's where a lot of the discomfort is. And it was interesting because this person I networked with also, we talked about stepping into that role. And if you don't see yourself as a yoga teacher yet, and you don't have to have 200 hours for that, by the way, it's going to feel more awkward, more uncomfortable. And let's say that you bring a practice in once and you offer this to a client, they're like, "What? Yoga? No, I'm not doing that." And it doesn't go well and it doesn't land, or they're like, "Oh, this feels awful." That might take you away from using these practices in the future, which I hate. It's so sad because it can be so beneficial. But I'm going to tell you 99.9% of the people I've used this with, yoga practices, it's been so beneficial and helpful. Now, there's a continuum. Some people are like, yes, this is amazing. Can we do more of this? And I've had some that are like, yeah, it was okay. So we got to watch our expectations too, that it's not always going to be a mind blowing experience. It can be just like, that was cool. Okay, maybe I'll try that. Or maybe I didn't really like it. And that's a risk, right? So it is stepping into the comfort. We're trained, supervised as mental health therapists to bring something in that, ooh, this just like when you started out, right? I remember the first time my internship and I had my first student as a school counselor because I started out in school counseling and the kid wouldn't talk. And I was like panicked. I was like, okay, what do I do? And I'm asking questions. She's like, I don't know. Like, oh shit. I actually left the room, got my supervisor. I don't know what to do. She won't talk. She's shrugging her shoulders. So that was rough. But that's the thing with yoga, right? If we can think about that, it's anytime we do something new, it's kind of scary. And of course, we have our licensing board. So we want to make sure that we are doing our due diligence to not cause harm, number one, right? And to be able to help clients in that transformation, right? Through mental health therapy, I think is so important. The other piece missing is not all yoga trainings talk about trauma informed language in my opinion. I think all mental health therapists need to be trained in trauma informed language if you're going to bring yoga in the therapy room, because you don't know who has trauma. I have had so many clients over the years that we did our initial assessment, we worked together sometimes for years. I don't find out till later that they have a trauma from their childhood. It's not easy for people to talk about trauma, especially initially in the first session or even the first year sometimes if it's something that could be filled with shame. It could be so difficult for them to bring up. So just be aware that we don't always have to have someone in front of us with PTSD. I put air quotes, but PTSD diagnosis to say that they need trauma informed language. I think it's helpful and beneficial for everyone. I recently went to a massage therapist and I was thinking as we're getting ready to start the massage that he was so trauma informed. He would tell me what he was doing before he did it, which I thought that's pretty powerful. It's pretty vulnerable, right? We don't have clothes on. We're under a little sheet, and he's a male. I'm a female, and I don't know if it's because he was a male, by the way, but he's like, "Okay, I'm going to put a warm towel on your back." I was like, "Yes, please do." But I can see how that could be jolting for someone with trauma. And as females, of course, I know we might be a little bit more like unsure. This was my first time with this male particular masseuse. So I think that's something to be thinking about as well. How do we pace our session so it feels more trauma informed when we bring something in that can be outside the box? And, we use that with language. So invitational language. So we can just say, I'm wondering if this could be something helpful for you. I bring breath work into sessions. Would you like to give it a go? And again, remember, yoga does not always have to be movement. There are so many different ways to bring yoga in the therapy room that is not movement. People think automatic, oh my gosh, I got to do a whole flow. And no, sometimes it could be one pose, can be a grounding practice. It could be just awareness of breath. bam, you just did yoga, right? But I think it's also getting to know yourself as a therapist and who am I? What kind of therapist am I? And how can I merge these two together, these two worlds, yoga, mental health therapy, in a way that feels aligned with my values and who I am as a therapist, and also my theoretical orientation, because there may be out there, but I don't know of too many yoga trainings that bring counseling theory in, right? Other than the one that I created, Yoga Basics. But so we have to, as mental health therapists, the other distinction is that we have to make this part of their treatment plan. We have to figure out how are we merging this with counseling theory. What does that look like? So that means maybe learning some additional ways to bring in different additional trainings, or research to figure out how do I bring this in. For me, I use polyvagal theory. I use some DBT. I kind of have a mix and match integrative approach, but that may not align with you, and that's totally cool. So figure out what works for you. Anyways, I thought this would be helpful. I did want to let you know that I do have a free training coming up, getting started with yoga in the therapy room, a step-by-step approach. So that's going to be on Monday and the October 13th, 2025. So that be looking for that. I'm going to put that in the links in the comments here. So if you are interested, it's free, no obligation to sign up for anything other than the training and be present. I will be talking about my membership at the end of that to give you more information, but that's it. And also, I will be sure to sign up for my new giveaway. So I have a free 10 top 10 frequently asked questions about bringing yoga in the therapy room. And I talk about so many things with ethics, with being able to bring it through telehealth versus in person, how to assess client readiness, how to get started, right? So more tips on that. And I thank you so much for being here and watching this video. I would love to hear from you. If you want to just type your name as well in the comments and let me know any questions you have. And I'm here for you. Have a good one.